Welcome to Richard and Greg, a channel dedicated to discussion, debate and argument on a whole array of topics. Well, less than 1 hour ago, British Prime Minister Boris Johnson has announced that England is to move from Tier 4 into Tier 5 lockdown as the result of a worsening coronavirus situation. So what does this mean? Then let's ask a man who is known for his bacteria, controversially Greg. Let's go over to him right away. Welcome to Richard and Greg. It's Monday, 4th of January 2021. And just about 1 hour ago, the UK Prime Minister Boris Johnson has announced that England is moving into Tier 5 lockdown, the highest tier that we have as a result of an out-of-control coronavirus pandemic. We're going to ask Greg what Tier 5 lockdown means, why has it happened, and what are its implications. So without further ado, Greg, good evening.
Good evening. And as to lockdowns, I do wish they hadn't called them tiers. There's enough tiers going on with 75,500 people dead from this pandemic in Britain and 361,000 dead in America. So much better to have called it levels. Anyway, we're now on level tier 5 lockdown. It's beginning to have so many different tiers that it's a slight muddle to work your way through who's in what tier and how. But basically, the country is now confined only to essential workers going to work, to everyone else who can possibly working from home, to the closure of schools and colleges until at least February half term, and I personally think longer. So effectively, it's as near total as we can get. Some essential services, certain areas of manufacturing, and some major industrial projects will continue to function, but only in a manner which is COVID safe. However, this still means that transport services will be running, and we all know that transport services are anything but COVID safe. So there are leaks in the system. However, with over 400 people having died in the last 24 hours in Britain, that's recorded, and over 869 people dying in America during a 24-hour period. The situation is not pretty. I remember Richard and I discussing this in February last year, and it was then that I said this would run and run. And I think there is little doubt that our rate of death in most countries is greatly escalated on the numbers who were dying at this time last year. And I think they will still continue to rise for quite some time. There was one glaring, massive loophole, in my opinion, in Boris's comment this evening. Firstly, I commend him for having taken this hugely unpopular step. People do not realize just how dangerous this pandemic is and how much more dangerous it could become. It takes an idiot to be looking for ways to excuse the numbers of deaths that we've had around the world. No, it's not as high as the pandemic of the Spanish flu, which reached 50 to 100 million. But it still isn't pretty, and we have a much more advanced world, and we have very high levels of death in anybody's estimation, save the callous or the crass. There is no doubt that to put any form of a screen between somebody who has the disease and somebody who has not will reduce the chances of the person who has not got it catching it. I'm not saying that it is in any way seriously effective. We hope it is, but there is no doubt that if you put a screen between somebody who is spreading the disease and those who have not as yet caught it, there is going to be a benefit, and every life is worth saving. And it is an act of pure, malicious selfishness to not wear masks or face screens of some description. And it is, in my opinion, a matter of criminal stupidity to be preaching no masks. And there are people doing it. It may not save a lot of lives, but there is no doubt that if you are screening somebody from the disease, whatever extent, it is a benefit. Boris Johnson left until possibly the last minute plus one the area of closing down schools, because many schools actually reopened today, only to be closed down this evening. If he had closed them down a day earlier, that would have been wrong. If he'd waited a further day, that would have been wrong. We don't know enough about this disease to be able to function absolutely accurately at the right time. We can only do the best we can on the advice given. We also have to be very wary of advice, because just like the climate change advice that supposedly comes out of scientists, so when you start reading the actual reports, there are so many caveats in there that they're fairly much useless. But of course, an awful lot of scientists got an awful lot of grants for doing research to come up with the answer that a certain sector of the population wanted. So we are a little skeptical of scientists at the moment.
But how do you marry that skepticism, Greg? On the one hand, you're saying scientists are saying wear masks, keep socially distant and so forth. And then on the other hand, you turn around and say, oh, don't listen to scientists. They're bribed to lie to you. You can't have it both ways.
I can have it both ways, and I will have it both ways. I introduced wearing masks as absolute common sense. It's not science that if you put a brick wall in front of somebody, the virus will not penetrate through it. You don't have a brick wall, but we have moved in that direction by putting a screen of some sort between people's noses and mouths and the faces of other people. It is common sense. That ain't science.
Okay, but how do you answer those people who say, look, we've had numerous lockdowns now since this whole pandemic began, and yet the death rate is going up and up and up, and all that's being achieved is the ruin of our economy?
Oh, with great ease. If we had not had those lockdowns, you would have found it would have gone up faster. It would have overwhelmed health services around the world. It has done in some countries. Italy was in dire straits at one stage. It just didn't have beds. We've got difficulty with one of the better health services in the world. And I've seen a lot of health services around the world. And ours is right out there at the cutting edge of being the best form of health service, because it's free to everyone who needs it. Free at the point of need to every citizen in the country. There aren't charges, and if you need the treatment, you will get it. However, our health service is so much under pressure that, for instance, hospitals in London have no beds available in intensive care, and they have been moving patients out of the London area as far as hospitals in Bristol. That's 120 to 130 miles away, to free up specialist beds for people who are coming in with COVID. So we are right on the verge of overwhelming our health service. And if that happens, we do start to move into appalling problems. The sort of problems where we will just have to tell people to stay at home and die. Because you cannot make provisions for anything much higher than the number of and rate of death that we currently have. We just don't have the handling facility. We cannot afford as a nation to sit there with a handling ability for, let us say, 1,000 deaths a day from a pandemic. We just don't have the logistical ability to cope with it. And we cannot afford to have that sitting idle for all the days that it isn't needed. So realistically, we are as close as we dare come to capacity. We are moving people around long distances in the country to exploit places that have vacancies to keep the machinery rolling. My one comment earlier was there is one glaring hole in the presentation that Boris Johnson gave this evening. He believes that we can be looking towards reopening schools if everything runs fairly, as he put it, with a fine wind in our sails. We can reopen at the February half term, which I believe is towards the end of February. And he said that this will mean that we have been doing around 2 million injections of the vaccine per week, across the United Kingdom. And this will have covered by that date, if everything goes to plan, all those over 70, all those in care homes, all those who are workers in care homes, essential services of that ilk, the vulnerable in younger age groups, i.e. those with heart conditions, lung conditions, and other conditions that make them vulnerable to the virus. What he overlooked, and to be fair, he said, with a fair wind in our sail, in other words, if everything runs to plan. Nothing ever runs to plan, not when a situation is under pressure. But let's give him the benefit of the doubt there. The one glaring example was that if the virus mutates, we could find ourselves dying like flies in huge numbers, and then we could switch to that overnight. There is fear at the moment of a mutation that has occurred in South Africa, and we have shut down all travel between Britain and South Africa. There's a danger of the mutation that would appear to have come from the continent to Britain having originated in Brazil, which means that many countries are not accepting travellers from Britain. However, I note that a notable television presenter went away for Christmas, although travel was excluded to the countries he went to, and as yet no action has been taken. However, an MP from the Scottish National Party travelled to London by train, not feeling well, and had a test when they were in London and found that they tested positive for COVID, and utterly irresponsibly, against all guidelines put out by the government, travelled back to Scotland on public transport with a positive test known to them. She has today been charged by the police and will eventually appear in court for her irresponsible behaviour, though I'm sure the charges will be considerably more serious than irresponsibility. I am pleased to see this because she, as an MP, was part of the team that made the law that stopped people visiting people over Christmas. But beware of mutation. This could still run and run.
Well, if that's the case, Greg, it looks like we're all going to be stuck in our homes for the rest of our lives.
No, because they have said that they are working on the virus, and if we can get herd immunity, which is in Britain is around 50 to 51 million people vaccinated, and it doesn't mutate, and we must look on the optimistic side, but we must also be aware there is a pessimistic side. We will be able to move more freely once 51 million people in this country have had the 2 jabs necessary. That will take just over a year to complete. So it will be able to ease up to some extent from the time when we have everybody in the groups I named just now over 70 and vulnerable below that age, those with heart and lung and other problems, and their carers and people in the care industry. Once they are covered, we will be able to relax a little. But we must be aware that we could find we are in a position where it has mutated dangerously.
Well, Greg, thank you for that, shall we say...
Picture of doom?
Yes.
I regret it must be if we are to act as grown-up, civilized individuals.
Yeah.
If we want to be totally irresponsible and gamble with the future of mankind for our own personal benefit, I can only see that as criminal irresponsibility.
Well,
we must take precautions.
there is, of course, the argument that if, as you say, there could be a mutation and there's no guarantee the virus will deal with that mutation, then you're going to end up in the worst of all worlds where everyone is locked up, your economies have collapsed, and you still can't avoid the pandemic or the virus.
Well, there is the slightly impolite statement of shit happens. But at this stage, that is no excuse to roll in it.
And on that lovely metaphor, Greg, thank you very much.
Not my pleasure, but I think it is our responsibility to point out that the more you can do to isolate yourself from other people, the safer those other people and you will be.
Thank you, Greg.
Good night.
We hope you enjoyed that discussion, and if so, kindly subscribe to our channel and press the bell sign so that you are notified of our videos as and when they are published. And also in the description box below, we place links to certain books, articles and programs which you may find of benefit, and for which we will receive a small commission should you purchase through our link. And this will help support our channel and to enable us to develop it further.